Hi, my name is Pip Inge. I'm one of the medical doctors here at the VIS, and we're going to be talking about navigating pregnancy and the postpartum athlete. In terms of how long you can continue to train and compete, it really is an individual process. Some people feel comfortable continuing to train throughout most of their pregnancy. Others have symptoms that limit them from very early on. Symptoms that can be limiting including significant nausea and vomiting, and sometimes quite a lot of pain as well, including pelvic pain and lower back pain. So it's very important to ensure that your training program is individualised. In terms of competition, there is no rule that a sport says you cannot continue to play, so it's very important to ensure that your whole team is around you to help you make that decision, from your coach, your sports medicine and sports science team, and your external obstetrician, to ensure we can do what is right for you and right for your baby. There are certain medical conditions which may preclude you from exercising whilst pregnant, but again, these are relatively rare. In terms of competing and injury to the baby, in the first trimester, so up until week 12, 13, the embryo is completely protected by the pelvis. There is no risk of trauma. From that time onwards, the baby grows bigger, and technically the pelvis cannot protect the baby at all times. So from a contact sport perspective, this needs to be considered as well. Look, again, it depends on you as the athlete. It's dependent on what you were able to do during pregnancy, how your birth went and how your recovery was post that. And again, important to be individualised. Usually it's recommended that a return to running is gradual, and to protect the pelvic floor and reduce the risk of long-term prolapse and urinary incontinence, traditionally it's said between 10 to 12 weeks before recommencing a running program. So it can be quite time consuming. It's very important to be proactive with pelvic floor management, and seeing a pelvic physio about 6 weeks postpartum is a really important part of that return to sport. Obviously the return to sport can be different for everybody, and I think we need to not underestimate the impact that being a new mum has on that return as well. Not only are you adapting to the changes in your physical body, but also that adaptation to having a new person in your life. The sleep deprivation, the challenges around that can be quite significant, so we need to be mindful about those things as well. Ensuring you have good social supports is really important, whether that's through a partner, family or friends. Looking to what childcare will look like for you to allow you to continue and get back in the gym and train. And also considering things like breastfeeding if that's something that you choose to do. From a breastfeeding perspective, there are a couple of things to consider if you are going to be a breastfeeding mum and an athlete. Number one is it takes a whole lot of energy to produce enough milk to feed your child. So speaking to your dietitian about how to ensure adequate energy intake to reduce the risk of having low energy availability, which in turn can have issues around injury and illness as well. We need to consider good bra support, and most people, if not everybody, will be needing a very new sports bra after having a baby, and acknowledging that the size of your bra may be different from morning to night depending on when you've last fed. Most people feel that feeding their baby prior to exercise gives them the most comfort if they are breastfeeding, and that would be something that would be recommended if possible. But also acknowledging, how do you actually manage to feed the baby if you're not there whilst training? Are you supplementing with formula, or are you pumping in those environments? Another one to discuss with your coach or with your sports organisation is, what does it look like for me to breastfeed whilst at training? Is there a room in which I can do that in? Am I comfortable doing that in the open? Do I have the facilities to put milk in the fridge if I am pumping? And just working out what that looks like and how it best works for you as well. So returning to running or jumping too soon after having a baby can put you at increased risk of having urinary incontinence, so leaking of urine, or having a prolapse as well. So it's really important to ensure you have clearance from pelvic floor physio and a gradual progression back into that running environment. It's also important to acknowledge that some people may not have been able to run for a number of months at the back end of their pregnancy, and so it may be close to 9, if not 12 months since they last had a decent running block. So other injuries that happen from a prolonged time off, whether that be soft tissue injuries or otherwise, need to be factored in as well. The other injury to consider would be bone health. So we mentioned low energy availability with breastfeeding, just being mindful about ensuring adequate energy intake with breastfeeding, but also trying to manage to feed yourself with a small child can be more difficult than what you first imagined. Obviously, having a dependent who's attached to you all the time can make it really hard to find time to look after yourself, let alone to get back to training. And I think the way that we need to look at that is you're returning to a work environment. So what supports do you need in order to do that appropriately and confidently? A lot of the time that will involve a lot of family support to assist, particularly in those early days, to get you back into that environment, whether that be your partner, your parents or other family members or friends. But also there's childcare, babysitter, nannies, those types of things which can certainly facilitate and assist.